Hi, my name is Brandyn. I'm currently alumnus of the Public Health Data Science program. I currently work for Southern California Clinical Translational Science Institute. I'm currently a programmer alumnus. I help to communicate which social determinants of health are within the databases and helping the researchers understand their data sets or their patient population. I decided to study public health data science because of its statistical computing, its biostatistics research, and the emphasis of computer science with it. I chose USC because of the resources, the Alumni Association, the renowned faculty that lead their research. I like that I was able to tailor my experiences to what were my needs and what were my interests. A lot of it was integration from computer science courses, statistical, within the realm of public health. My interactions with faculty on campus was a good one. A lot of it, they just want to have a conversation with you. If you really communicate your experiences and your interests with them, they'll help to relate with that and show you other resources or other professors that you can get involved with. Some of the skills that I learned was biostatistics modeling. I learned a lot of regression analysis, having to tailor those results and communicate it back to a lay audience. I like that the research that continues to go on is that it can help people. I like to think that my work contributes to research. One of my highlights within the program was with Dr. Trevor Pickering's summer course, where we did an internship for clinical researchers at CTSI, analyzing their questions, presenting them in a report, going through the step-by-step basis from start to finish of analyzing their data, communicating the results, and presenting that back.